As we near the end of 2024, the world remains vigilant in the ongoing battle against COVID-19. The virus continues to evolve, presenting new challenges in the form of emerging variants like FLiRT and LB.1. Meanwhile, public health authorities are responding with updated vaccines aimed at providing better protection against these and other circulating strains. This script explores the latest developments in COVID-19, including the characteristics of these new variants, the scientific community's response, and the public health strategies designed to mitigate their impact. The FLiRT and LB.1 variants are the latest in a long line of mutations that have emerged since the start of the pandemic. These variants were first detected in the United States through advanced wastewater testing, which has become a critical tool in tracking the spread of the virus. The FLiRT variants, in particular, have raised concerns due to their unique mutations on the spike protein, which may allow them to evade immunity more effectively than previous strains. Dr. Scott Roberts, an infectious disease specialist at Yale Medicine, emphasizes that while viruses mutate regularly, the emergence of variants like FLiRT is a reminder of the unpredictability of SARS-CoV-2. These mutations are a testament to the virus's ability to adapt and survive, making it imperative for us to stay ahead with updated vaccines and public health measures, says Dr. Roberts. The LB.1 variant, closely related to FLiRT, also descended from the JN.1 strain, which was dominant in the US during the winter of 2023. Researchers are particularly focused on understanding how these variants might affect transmissibility and severity of illness, though early indications suggest they may not be significantly more dangerous than previous variants. However, their ability to spread rapidly means they cannot be taken lightly. In response to these new variants, the FDA has approved and authorized updated mRNA COVID-19 vaccines. These vaccines are designed to specifically target the KP.2 strain, a descendant of the JN.1 lineage, which has been identified as one of the predominant strains currently circulating. The decision to focus on a monovalent vaccine, rather than the bivalent boosters previously used, reflects a strategic shift in how the medical community plans to manage the virus moving forward. According to the FDA, the updated vaccines are expected to provide stronger protection against severe outcomes, such as hospitalization and death, even if they cannot completely prevent infection. Dr. Peter Marks, director of the FDA's Center for Biologics Evaluation and Research, notes that vaccination remains the cornerstone of COVID-19 prevention. He strongly encourages eligible individuals to receive the updated vaccine to maintain their immunity as we head into the colder months, when respiratory illnesses typically surge. The updated vaccines have been formulated based on the most recent data on circulating variants, making them more targeted than previous versions. This approach mirrors the annual flu vaccine, which is updated each year to address the most likely strains. The new COVID-19 vaccines include the Comirnaty and Spikevax formulations from Pfizer-BioNTech and Moderna, respectively, which have been approved for use in individuals aged 12 and older. For younger populations, these vaccines are authorized under an emergency use authorization, ensuring that children as young as 6 months can also receive protection against the virus. The CDC continues to update its guidance to help the public navigate the ongoing risks posed by COVID-19 and other respiratory viruses. The latest recommendations stress the importance of staying up to date with vaccinations, not just for COVID-19, but also for other respiratory illnesses like the flu and respiratory syncytial virus. These measures are crucial for protecting vulnerable populations, including the elderly and immunocompromised, who are at higher risk of severe illness. In addition to vaccination, the CDC advises the public to practice good hygiene, such as frequent hand-washing and covering coughs and sneezes. The agency also recommends improving indoor air quality by increasing ventilation or using air purifiers, especially in settings where people gather indoors. For those who do become ill, the CDC suggests staying home until symptoms improve and taking extra precautions, such as wearing masks and maintaining physical distance, for several days after returning to normal activities. These strategies are designed to minimize the spread of the virus and protect those who are most at risk. On the global stage, the World Health Organization continues to play a critical role in monitoring and responding to the COVID-19 pandemic. The WHO's Disease Outbreak News provides regular updates on the status of the pandemic, offering valuable insights into how different regions are being affected and what measures are being taken to control the virus. The organization emphasizes the importance of international cooperation and the sharing of information, as no single country can tackle the pandemic alone. The WHO also highlights the need for equitable access to vaccines, particularly in low- and middle-income countries where vaccination rates remain low. Ensuring that all populations have access to vaccines is not only a moral imperative but also a practical one, as unvaccinated populations can serve as breeding grounds for new variants that may eventually spread globally. Looking ahead, experts believe that COVID-19 will likely continue to evolve, requiring ongoing updates to vaccines and public health strategies. Dr. Roberts from Yale Medicine predicts that the pattern we are seeing now, where new variants emerge and vaccines are updated annually, will become the norm. This approach is similar to how we manage influenza, with the goal being to stay one step ahead of the virus by anticipating its next move and preparing accordingly. However, there is also hope that as more people gain immunity through vaccination and previous infections, the overall impact of the virus will diminish. The widespread availability of antiviral treatments, such as Paxlovid, which remains effective against current variants, is another tool in the fight against COVID-19. These treatments, along with vaccines, form a comprehensive approach to managing the disease, reducing the likelihood of severe outcomes and helping people recover more quickly if they do become infected. As we continue to navigate the COVID-19 pandemic, staying informed and adhering to public health guidelines are more important than ever. The emergence of new variants like FLiRT and LB.1 serves as a reminder of the virus's ongoing evolution, but with updated vaccines and a robust public health response, there is reason for optimism. By remaining vigilant and taking proactive steps to protect ourselves and our communities, we can mitigate the impact of these variants and move closer to a future where COVID-19 is a manageable part of our lives.